Hi there, I hope you're doing well, and I absolutely hope that everything is going well for you. Welcome to Elevate Nursing, where we explore and share professional development resources for nurses and midwives, both students and practitioners. Today we're doing something different, and this is answering NCLEX questions, particularly to serve those who are preparing for their licensure exams, be it the Nursing Council of Kenya licensure exams or the NCLEX exams. As well, for anybody out there who would like to refresh their clinical knowledge, this is a useful session. And any student out there who's curious about NCLEX questions and licensure exams, I think you'd find benefit in this in terms of the structure of the questions, how to answer these questions, and so on. So this session will be lasting about 10 minutes. We'll answer 5 questions, and the structure basically is there are multiple choice questions. I'll read out the question and we'll have a short discussion as we look at the choices available. After that, we'll make a selection based on this discussion and select the most correct answer. With that, I will leave links in the description box to all the information that we will be using during this session, because we aim to have evidence-based practice. So the information that we'll be sharing with you is evidence-based. With that, if you are working towards exams or if you're just in the learning process, I will leave links in the description box as well to some skills and ideas that you can put into your learning process that really activate learning. They are useful towards concentrating on specific subjects and preparing for exams. With that, I wish you all the best if you're preparing for these exams, and we will be having these on a regular basis. These resources are for educational purposes. They're exclusively meant for nursing and midwifery education. It is not medical advice and should not be used as such. So let's get down to it. Today we are answering 5 questions around medical surgical nursing. So let's get into it. The first question reads, which of the following are locations for placing pulse oximeters in adult patients? A, earlobe. B, tip of the finger. C, tip of finger with non-invasive BP cuff. D, tip of the nose. So we can answer this by elimination. Earlobe is out of the question. It is not an appropriate area to put a pulse oximeter in an adult. But if you think about it physiologically, blood circulation to the earlobe is not as much as that to the tip of the finger, because the earlobe is basically cartilage, and blood circulation to the cartilage is not that good. So you wouldn't really get the correct oxygen saturation levels. Tip of the finger, B, is the correct answer. Well, as it is, there is a rich blood supply to this area, and it's appropriate for the structure of the BP cuff, of the pulse oximeter. Tip of the finger with non-invasive BP cuff is not appropriate really, because with the expansion of the BP cuff and contraction, it limits the complete blood circulation into this area. So you might really not get the correct answer, but it doesn't mean that it stops blood circulation to the point where it's insufficient to have supply of oxygen and nutrients to the tip of the finger. Tip of the nose is absolutely out of the question. So the correct answer is B, tip of the finger. So let's look at the second question. A geriatric patient under your nursing care in admission for hypertension presents with the following symptoms: a blood pressure of 140 over 40 millimeters of mercury, pulse of 120 beats per minute, and respirations of 36 beats per minute. Which is the initial action the nurse should take? Okay. A, reports the findings to the physician. B, recheck the vitals in an hour. C, inquire if the patient is in pain. D, compare the findings with the admission vitals. Now, this question really requires us to select the most appropriate answer, because most of these answers are rather correct. To check if the patient is in pain is quite obvious in this case, because this pulse rate of 120 is significant, indicates tachycardia. Normal heart rate is 60 to 100. A blood pressure of 140 over 40 millimeters of mercury is indicative of a wide pulse pressure. Respirations of 36 beats per minute, that is tachypnea. So the first option that the nurse would do is report these findings to the physician, but as well inquire if the patient is in pain. as you do this, because this could be heading on into an emergency case. Yeah, this is heading on to an emergency. So observe the patient, but do report the findings to the physician. The option B, rechecking the vitals in an hour, is out of the question because of the wide pulse pressure and the tachycardia. So it could mean so many things. Tachycardia could come in from blood loss. The patient could be having an internal bleed. Respirations that are high. The pulse rate as well could indicate anxiety and so on. So that's the correct answer is A rather, report the findings to the physician immediately. Inform as well the physicians of any other symptoms that the patient is presenting, if they're pale, if they're sweaty, and so on. B, C, and D can be done as well, but that can be done after the physician has been notified. So the correct answer is A, immediately report the findings to the physician. During CABG surgery, when patients are connected to a CBP machine, to what temperature is the blood cooled, then returned to the body? A, 28 to 32 degrees Celsius, B, 34 degrees Celsius, C, 30 degrees Celsius, and D, 25 to 38 degrees Celsius. We will answer this by elimination as well. CABG surgery is basically coronary artery bypass graft surgery, and it is part of the revascularization surgery for CAD, coronary artery diseases. For example, myocardial infarction. And a cardiopulmonary machine is where the blood is bypassed through the machine when the grafting is done. Yeah, so the blood needs to be cooled down. The reason for cooling down the blood is to lower the metabolism. And if you lower the body's metabolism, you basically lower the oxygen and the oxygen needs. Therefore, it basically lowers the demands for oxygen and nutrients in the body. Therefore, the surgery can be done efficiently, to put it simply. So, let's do it by elimination. 25 to 38 degrees Celsius is out of the question because that's basically a fever. That's too high. 30 degrees Celsius is within the range, but that we really cannot aim for a specific figure. It's important to have a range, and that way, if a patient fluctuates within that figure, within that range, then they are within a safe number. 34 degrees Celsius is out of the question because that wouldn't really be cooling down the body all the way. Yeah, so 28 to 32 degrees Celsius is the correct answer. Question number 4. Which of the following are monitored during CABG surgery to maintain a functional physiologic status? A, urine output and blood pressure. B, arterial blood gas measurements, electrolytes and coagulation studies. C, ECG. D, all the above. The correct answer is all the above. The urine output is done continually to check the functional status of the kidneys. Blood pressure is done as well continuously to check the functional status of the heart as the surgery goes on and to ensure that circulation really is going on well. ABGs are done because the patient really could go either to acidosis or alkalosis depending on the oxygenation status of the blood. Electrolytes are done as well continually to check the function of the kidneys, and apart from that, to check if the patient is losing electrolytes by bleeding and so on. Coagulation studies are done because heparin is used in the process of a CABG surgery, and an ECG is done to check the functional status of the heart. So the correct answer is D, all the above. The final question, number 5. During the discharge process for post-axillopopliteal bypass graft surgery, which of the following should the nurse teach the patient to avoid? A, resting on a recliner chair. B, lying in supine position. C, sitting in an upright chair. And D, resting or sleeping in the right seams position. Now, basically, this means CABG has been done and the graft has been collected from the axillopopliteal blood vessel. I'll leave an image of that here. And with that, because the graft has been collected from this area, one of the factors to consider is circulation to the foot has been influenced in a particular way. And most of the time you might find that there might be swelling of this foot because the circulation has been affected in this case. And what we advise patients to do is to ensure that you don't wear tight clothing, and that's going to allow blood circulation to move on swiftly. If a patient wears tight clothing, then they further inhibit blood circulation to the foot, and that's going to worsen the swelling on the foot. So what's the correct answer in this case? Sitting in an upright chair is prohibited, and wearing tight clothing as well is prohibited. So option number C rather is the correct answer. What should the patient avoid? Lying in supine position is okay. Resting on a recliner chair, that's okay. And sleeping in right seams position is allowed. So all the other answers are not appropriate for this question. So those are the questions that we have answered for today. As you prepare for your NCLEX exams, I wish you all the absolute best. And next time we will be answering 5 more questions around pharmacology. And we'll have an episode as well that will be on drug calculations. If you have found this useful, go ahead and like this video, and you can subscribe, and that way you'll be notified whenever we put out videos in terms of NCLEX questions, NCK questions, or any other resources related to nursing and midwifery development resources. I'll see you soon. Have a lovely day, and until next time, elevate nursing. Take care. Bye.